information education type pieces for individuals, as well as tying it to your environmental change strategies that coalitions are so often engaged in. Policy change, changing community norms, addressing access and availability in your community, policy and enforcement, those kinds of pieces. So social marketing can really help tie all this together, and we really thought about that a lot as we were putting together Drug-Free 24/7. So looking at how a social marketing campaign can change community norms, let's take a sample community. And before a campaign was implemented, maybe that community had some norms where it was accepted and even kind of expected that teens drink. It's just what they do. Maybe it's what a lot of adults in the community did when they were teenagers, and they figured they're fine, the kids will be fine. It's just kind of a rite of passage. And so then there's norms that develop within that community, not only among the parents, but even among formal systems like law enforcement, where if it's so accepted and expected that kids will drink, a lot of adults are looking the other way. Maybe even making it easy for that behavior to happen. Maybe the enforcement is a very low priority, or parents are even providing the alcohol at teen house parties. And then a social marketing campaign comes into play in the community that helps raise awareness of the problems in the community related to alcohol and other drugs, or teens drinking in this example, and helps to start change some norms. And over time, ideally that paired with some other prevention activities, you get a community where people start to realize that many teens do graduate without drinking. So maybe you've done a social norming campaign where you said, look, most of our kids actually don't do this. Why do we assume they all are when many don't? So let's realize that kids are graduating without drinking and they're doing great. And then we start shifting the norms that are impeding that drinking behavior, and non-enforcement in that community becomes less tolerable. There's more pressure put on law enforcement to enforce underage drinking laws. And parents serving as hosts are seen as not acceptable by other parents particularly, and there's some parental peer pressure about not doing that starts to come into play in the community, and you start seeing a shift and a change in that community toward healthier norms and healthier decision making. That's the overall goal of how social marketing can fit in. As you're gathering information and making a plan for your social marketing strategies, it's real important that we do gather some data. And that doesn't always mean real formally and expensively through a survey, although that's fabulous if you're able to do that. But you can also do that very informally through more of a Survey Monkey, not so professional survey. It doesn't even have to be by an evaluator. It could be something online. It could be a survey at the basketball game or football games that you guys compile yourself, and it's only a couple questions. Maybe you do some focus groups with some different key leaders or gatekeepers from different target populations in your community, or some key informants, or have dialogue nights between teens and parents and let that surface what's going on. And you start to get a better sense of what are the existing norms in our community, perceptions among the general population or among a certain target population. The other thing that we encourage you to do as a tip is to look at this as being something you do across the lifespan, that we don't just focus on kids and their alcohol and drug use choices. That means that for a lot of folks, we got to stretch and grow in where we gather data, and we want to look at adults and their use and their perceptions of each other's use as adults and what the norms are. If the norm is to drink to intoxication for those who do drink, that's a norm to be challenged, etc. And we also want to encourage you to look across community sectors. Again, if you're not just looking at kids, you need to think about how do you reach adults? How do you get more information about adults? And we're going to give you some really great ideas about that before the end of the webinar. We also would definitely like to have you address not only community beliefs, but looking at what are the perceptions versus the realities. So maybe you've got a perception that the alcohol problem's not really that bad and the real problem's heroin, but then you have your, especially among kids, and then you have your school-based survey that says heroin is a very small percentage of our students' use, and alcohol is by far our most abused drug. How do you help to change that? Because you may even have gatekeepers in your community who want to put all their attention on heroin because, of course, it's scary, and it's not saying it's not a problem, but if your primary drug of abuse is alcohol and it's not being addressed, that's a problem in the community. So how can you get more crossing different alcohol and drug-related problems with a more comprehensive message. And we think the drug-free 24/7 banner, flying things under that, really helps you to do that. A few other social marketing tips as you make your plan. We want you to ensure some breadth in that plan, again, that you cross community sectors, that you don't just target kids. If you are targeting kids, you do need to target adults that interact with kids, from pediatricians and orthodontists and parks and recs and coaches and scout leaders and all kinds of different folks that interact with kids, but we encourage you to think across the lifespan anyway. So that's going to involve even a lot more community sectors. Where do adults work? You've got to engage business. And that you get year-round with it. So that gives a lot of breadth, but then we also would like to encourage you to have as much depth as we can. And that means a saturation of the message throughout your community. And that's why a consistent message like Drug-Free 24/7, that's a banner that you can hang everything around, gives you that repeated messaging and a saturation that keeps being reinforced, and you can reach people in every aspect of living. And we always like to say that we want to reach people where they live, where they work, where they shop, where they worship, where they learn, whether that be traditional school, secondary school, GED classes, other kinds of CEU programs even for adults. Where do they get their information? Through the media, in their health and their health care providers, what information they provide, how they communicate. We need to meet them where they're at and how they communicate these days. That means digitally, and that includes where they interact through social networking sites such as Facebook. And Drug-Free 24/7 is really designed to make that comprehensive kind of plan pretty easy to pick up and run with. So before we roll that out, a few more things about communication that really help you understand why we designed Drug-Free 24/7 the way that we did. And that is the communication to be effective. That communication strategy means you need to have consistency in a couple areas. Consistent branding gives you the ability, when folks think of you, they think of that image. They see that image, they think of you. So by tying yourselves and your message to that consistent visual, that's going to give you a lot of legs in your community. It's going to carry you very far. Consistent messaging allows you then to speak with one voice, and that is important for communication. And consistent process, then that allows you all to act with one purpose. And social marketing really can be a way to help you achieve all three of these communications goals for your agency, for your coalition, your organization. And that's why we like to take a look at the importance of consistent messaging when it comes to social marketing. Once a message is out there and it's coming from a credible source and it's tied to credible information, you get believability. That's a given. So we only give you the banner and some ideas. There's still some work you'll have to do, as you'll see when we go through the tour, where you're gathering some data and facts and research to fly under that banner and of Drug-Free 24/7, depending on your target population. So having credibility in that information will give you believability. Then with repeated exposure, when that message is stated often enough, it becomes ingrained, and then consumers buy into that message, and that gives you buyability. When you combine believability with buyability, what you get is capability. And that means that the receivers of all your messaging, they're going to start to see you or your group as the expert, and they're going to reach out to you and seek your input. So a community leader, something happens, even in a government setting or a policy issue, they're going to know to call you or your agency or coalition about that. If something goes on in the medical field and there's something alcohol and drug related, you're going to be the first folks they think of because you've already been working with them to get this message out to their patients. So it's a powerful way to really get far with your messaging. So last thought before we look at Drug-Free 24/7, wanted to just hit the objectives of branding. We all hear that word a lot these days as people talk about media and media messaging. And basically when we're looking at branding, the key is to deliver your message clearly and keep it simple. You want to connect with your audience emotionally, and you want to motivate your audience as well. So there should be some kind of step they can take or a call to action in what you do. And all of that should work together to solidify your message and confirm your credibility.